This video demonstrates the microsurgical technique used to remove an intradural extramedullary tumor proven to be a Myxopapillary ependymoma. Upon completing a lumbar laminectomy, we have performed a midline opening of the dura and dissected the superficial arachnoid layer. Prior to start any tumor manipulation, a complete exposure from upper pole to lower pole is complete in order to allow safe dissection of the tumor, avoiding excessive manipulation of the spinal cord and the caudequina. The tumor is gently mobilized by the assistant, stretching the arachnoid layers. A microhook is used to define the plane of cleavage. Any vessel which is identified, cauterized, and cut, avoiding tearing and bleeding in order to keep the plane of cleavage always visible. Note that the manipulation is performed on the tumor side and minimal traction is placed on the spinal cord. Every small vessel is carefully identified, cauterized, and cut. The dissection proceeds to the inferior pole and the limits are dissected and identified. From this point, we perform sharp dissection of the arachnoid adhesions, releasing the lateral aspects of the tumor from the caudequina. Those adhesions need to be identified, dissected, and cut with microscissors in order to avoid mobilization of the tumor without excessive traction on the spinal cord and the caudequina. Small vessels are identified, cauterized, and cut to avoid bleeding, which would obscure the plane of cleavage. At this stage, the origin of the tumor at the level of the conus medullaris is identified. Neurophysiological monitorization is used to identify EMG activity of the nerve roots related with the lower extremities muscles or anal sphincter. In this case, we detected activity of the anal sphincter, and further dissection allowed identification of small rootlets. Once a safe zone is identified in the junction between the tumor and the conus, it is cauterized and cut, therefore allowing the tumor to be released. Further dissection from the caudequina allows mobilization of the tumor. The last attachment of the tumor is on the filum terminale, which is identified and cut, allowing en bloc resection of this lesion.